Squish. Hello, Mr. Fung. My name is Ryan. I'm a nursing student. I'll be conducting a cardiovascular assessment on you today. Is that okay?
Sounds good.
Great. Before I start, do you have any allergies that I should know of?
No.
Okay. Can I see your wristband? Tell me your name, date of birth.
Zachary Fung, January 8th, 2001.
Great. All right, so like I said, I'll be conducting a cardiovascular assessment on you today. That'll require me to look at both the front and back of your chest, and I'll be feeling for different pulses in both your arms and your legs. Are you okay with that?
Sounds good.
Great. And I'll also be using my stethoscope to listen to your heart sounds as well as your lung sounds. Are you okay with that too?
Okay.
Great. And at any point during this whole process you feel pain or discomfort, please let me know. I'll stop, we'll take a break, and then we'll continue back on. Is that okay?
Okay.
Great. All right. So just doing a general assessment of the patient. The patient has upright posture. He appears to state at age of 19. He does not look like he's in any pain, discomfort, or distress. He is well dressed for the weather, and he has no signs of pallor. Okay. So Mr. Fung, now I'm just going to do some questions to help guide my assessment on what I should be looking for or could be looking for throughout this whole process. Just answer them to your best ability. Is that okay?
Yeah.
Great. So first of all, have you had any problems with either your heart or your lungs?
No.
Okay. Have you ever had any test done on your heart, like an EKG or a stress test or anything along those lines?
No.
No? All right. Do you have any chest pain?
Nope.
Do you have any shortness of breath?
No.
And have you taken any medications for your heart or your lungs?
No.
No? Okay. So those are all my questions. Now I'm going to go on to the actual assessment, okay?
Yeah.
If you could just remove your shirt, I'm going to go inspect your chest. All right, great. Patient's chest contour is symmetrical, no obvious deformities, no pulsations, no obvious lift or heaves, and no scarring due to devices being implanted. Okay. Now I'm going to use my stethoscope to listen to your heart. Okay.
Yeah.
I just need you to sit there. You don't have to do anything. I'm just going to listen specifically. Okay.
Okay.
All right. So this first spot I'm aiming for is your second intercostal space. Second intercostal space, right sternal border. This is your aortic valve. S2 louder than S1, no extra heart sounds or murmurs, and a regular rate and rhythm. All right. So now I'm going to go across the way to your second intercostal space, left sternal border. This is your pulmonic valve. S2 louder than S1, no extra heart sounds or murmurs, regular rate and rhythm. Okay. All right. Everything sounds great. Now I'm going on to listen to your back. I'm going to be listening for your lung sound specifically, okay?
Okay.
Great. So if you just turn a little bit. All right. Just want to let you know, every time that you feel my stethoscope touch your skin, just take a deep breath, and we'll just do that for about 8-9 spots, okay?
Okay.
Sounds good. This first one is your left upper lobe. Great. Right upper lobe. Right upper lobe again. Left upper lobe. Left lower lobe. Great. Right lower lobe. Right lower lobe again. Left lower lobe. Great. And if you lift your right arm real quick. This is your right middle lobe. Great. Lungs were clear to auscultation. No adventitious breath sounds can be heard. No crackles, no wheezing, and no rhonchi. Okay. The next thing we're going to go on to, Mr. Fung, is if you can just hold out your arms real quick. All right. Great. Do you have any pain when I press down here?
Nope.
All right. Patient has no pain upon palpation or no tenderness upon palpation. Skin is even pigmented. It's warm and consistent. It is dry and symmetrical bilaterally. Right? Capillary refill is less than 2 seconds, and he has no signs of erythema or edema on his upper extremities. Okay. Now I'm going to go palpate your pulses. If you just hold your arm out. This is your brachial pulse of your right arm. 2+ regular rate and rhythm. Okay. This is your radial pulse of your right arm. 2+, regular rate and rhythm. Right. Now this is your brachial pulse of your left arm. 2+, regular rate and rhythm. This is your radial pulse of your left arm. 2+, regular rate and rhythm. Patient's brachial pulses were 2+, regular rate and rhythm bilaterally, and his patient's radial pulses were 2+, regular rate and rhythm as well bilaterally. Okay, you just hold your legs out real quick. You can relax them a little bit. Right. If any pain,
no,
or discomfort,
nope.
Okay. Upon palpation, no tenderness is felt by the patient. Patient's skin has even pigmentation. It is warm and consistent. It's dry. No signs of denting when pressed upon the tibial plate. Is capillary refill is less than 2 seconds. Okay. Now I'm gonna go feel for your pulses in your feet. This first one is your posterior tibialis of your right foot. 2+, regular rate and rhythm. This is your dorsalis pedis of your right foot. 2+, regular rate and rhythm. Okay, this is your posterior tibialis of your left foot. 2+, regular rate and rhythm. And that's your dorsalis pedis of your left foot. 2+, regular rate and rhythm. Patient's posterior tibialis are both 2+, regular rate and rhythm bilaterally, and his dorsalis pedis is 2+, regular rate and rhythm bilaterally as well. Mr. Fung, that is all I have to do for my assessment today. Do you have any questions before I head on out today?
Nope.
All right, great. You have a great rest of the day then, okay?
Okay, thanks.
Squish.